Gibson Kohli here with Snackable Health. We're talking about all those new variants that are coming out of COVID and what we're doing to combat them with variant-specific vaccines. How are we doing in that battle, pile?
The good news here, Mike, the FDA in June actually told all the vaccine manufacturers that they would have to have variant specific vaccines in the next iteration. We're talking about BA4 and BA5, which are the dominant circulating subvariants now of Omicron. But I'll be honest with you, in my opinion, it's a little bit too late in the coming because, as you know, with our president currently being infected and friends and family members and patients having illness, we are still having a very high number of cases. So I almost wonder if we're one step behind when it comes to designing our vaccines. And really, they should be coming out now so that we can curb some of the infections that are occurring. Because if they come out, late fall, at that point, we may already be dealing with a potentially new variant. In fact, there's already a variant BA2.75 from India that's here in the United States in multiple states that appears to perhaps be even more contagious than the BA5 variant and has a slightly different signature with respect to evading our immune system. So I think we're getting there, but we need to do a little bit more and a little bit faster.
Oh, do we need to move away from just targeting BA5 to more of a polyvalent approach where we target a lot of different variants with the hope of, all of that coming together to be more effective?
Yeah, that's a great question, Mike. So there's dissension here between the U.S. FDA and CDC and the World Health Organization. So the WHO is saying, let's cast a wider net so that we're not just targeting the variants that are currently circulating, but we're actually targeting variants that could, be born from earlier generations. And
Right.
that way we give a more broad immune response. So even though your risk of getting infected with any specific variant might be a little bit higher, but your overall immune response is a little bit broader and wider. The CDC and the FDA, on the other hand, are saying let's have a depth response. Let's target the variants that are specifically out there so that we reduce potentially the number of infections. My personal opinion is actually probably a little bit of both. So maybe we need a 4 and a 5 in there, and we might need a little bit more of a parent strain, like the Omicron parent strain BA1, or perhaps even an earlier generation one, so that we can have the breadth of response as well as the depth of response.
I agree. I agree with your take. Broad and deep is how we have to go. Thanks, Pyle, and thanks to all you for joining us here with Snackable Health.